Hi everyone, welcome back to my channel and welcome back to another video. Today's video will be a short one. I did not have a properly planned video for the week, so I decided to do a medical topic today, more for education, especially for our older folks in St Lucia specifically. So I'll be talking about 3 different misconceptions when it comes to health or medical care or treatments in St Lucia. I don't know about other Caribbean islands, I only know about where I live. So if you're listening or watching, please show it to especially your elders, your grandparents, your parents, because a lot of our older generation have some misconceptions, and I want to try to clear a couple of them up for them and for you. Okay, so the first one is seizures and strokes. So there have been several times in my 2 places of work that I have worked so far that I see this being done, and I think it is very dangerous. Nutmeg. People tend to put nutmeg in people's mouths when they think they're having a seizure or a stroke. Now, this is a huge problem, because when somebody's having a seizure or a stroke, sometimes they don't have control of their swallowing reflexes, right? So they can easily, guess what? Choke on the nutmeg. So if you're suspecting somebody is unwell, seizure, stroke, or whatever the case may be, please do not put any nutmeg or any objects in their mouth. They can choke. If you think somebody's having a medical emergency like a seizure, the best thing to do is to lay them on their side, because people who have seizures can foam at the mouth and can like breathe in the foam and the mucus and the maybe vomit and stuff, and they can aspirate, so it can go into their lungs. If you want to help, put the person on their side so that the stuff can fall out. Okay, please do not put anything in their mouth, please. The second thing is how can I say it? The big divide between herbal medicine and pharmaceutical medicine, right? We have a very dangerous mindset of either or. So it's either you fully herbal or you fully pharmaceutical. That's not how it works, okay? You can co-manage with different things. We can work together, it doesn't have to be either or. Because we have a lot of patients who come in known and diagnosed diabetes or diabetics, who come in when their sugars are like 500, 600. This is very dangerous, right? They initially maybe will manage with insulin or some other type of diabetic medication, and then they decided to go to a herbal doctor who discontinued the entire regime, or they themselves stop their medication and go to garlic and things like that, which I've heard quite often. People take garlic and clove and other things to lower their blood sugar, right? And then they come with very high sugars, and then we have to kind of scramble to try and get them together. So if you are interested in the herbal route of things, especially if you're diabetic and hypertensive, those are things that you discuss with your doctor, right? If you want to implement more natural remedies and stuff, sometimes it's very difficult to reduce or stop your regular medication, so it might not be a safe thing for you personally to do. And again, I'm stressing, it's an individual basis, right? So some people with diet and exercise, reducing their salt, different things, they can reduce the amount of medication that they use. Some people, it's very dangerous to stop it, right? Because you end up having a medical emergency, like very high blood sugars, very high blood pressures that can cause heart attacks, that can cause strokes, and this is where problems happen. Okay, so If you want to have a discussion with your doctor about these routes, have the discussion. I urge you, please do not just stop the medication at home and then pick up something and say, okay, you're treating yourself. And if you are doing that, at least check your blood sugar, at least check your blood pressure at home to see if it's working, right? Some people just stop and they say they're doing their natural thing and they don't even check their sugars, they don't even check their pressures to see if what they're doing is working. Ok, c'est mon là, so pas de bout, c'est médication ou ka point, et pas check call. Parler avec docteur, right? Pour discuter qui ça vous voulez faire et pour faire de manière qui bon pour vous, ok? The last thing I want to talk about today is mental health. Okay, so May is Mental Health Awareness Month. So a lot of us in St Lucia have a misconception on mental health, what it means, who can suffer from it, and things like that, right? So there are a lot of mental health disorders, right, that are found globally around the world. Anybody at any point in time can have a mental health issue. Anxiety, panic attacks, things like that are all mental health conditions or issues that anybody can have for any reason or another, right? So I find that there is still stigma attached to the topic of mental health in St. Lucia, specifically things like psychosis, like they say people going mad and things like that. We have to stop using this kind of language, especially that the person is going mad and so on. These are things that prevent people from seeking help, right? What will my friends think? What will my neighbor think? What will my parents think? There are different things that can happen. Somebody can have postpartum depression and anxiety, right? Somebody can go through a traumatic event and that can affect their mental health, right? People can have schizophrenia, they can have other forms of hallucination and things like that, right? That doesn't mean that the person is going mad. That means there's a mental health issue going on, right? Now, a lot of the mental health issues in especially a lot of our men, young, middle-aged men, is caused by, like, I don't want to like group everybody, but a lot of it that we're seeing, like people on the streets and stuff, is maybe due to either like legit mental health conditions that they didn't know how to address growing up, or maybe induced by alcohol and drug use, right? So all of these types of or brackets of people need help. Okay, it's not that they just woke up one day and went mad. They probably have a mental health condition and they don't know how to deal with it. Their parents didn't know how to deal with it when they were younger because of the stigma again. So like it's like a cycle, right? So yeah, I hope you all understand what I'm trying to say. So yes, that's it for my little bits of education today. I hope you understood what I was trying to say on each different topic. If you want to have a discussion about it further, maybe I can make an extended video about each of the topics that I spoke about. If you want to discuss something else, please let me know in the comments. And I would just urge our younger generation to try and educate yourself on different misconceptions, and then in turn educate your parents, educate your grandparents, right? Educate your neighbors about the different things that they may be doing wrong or maybe approaching in the wrong way. And we don't have to bash people to correct them. Just by educating people alone, that can help like them to see the logic of, okay, I'm not supposed to put nutmeg. Why is that? Because if the person is having a seizure and they're having a panic attack and they're having a stroke, they cannot swallow. What might most likely happen? They can inhale the nutmeg. So just explaining to people why certain things should not be done or why things should be done differently, it can help a lot of people see our logic. Now, there are some people that are very stubborn and they might not want to listen, but at least we can try. Okay, so that's it for today. I was hoping to do more medical education videos for the year. Like I had a schedule and everything in mind set already, but I never went through with it. So I might incorporate that into my videos going forward. Maybe not right now, but maybe next year I will like make a slot each month to address a different topic that specifically has to do with our St Lucian population, and hopefully to start educating especially our older generation about different topics that they might not necessarily understand when they go to the doctor's office and things like that. So that's it for my video for today. I hope you enjoyed, I hope you understood, and I hope you educate your loved ones on what you learned today. And I will see you in next week's video. Bye.